All right, good morning, everybody, and welcome to the 10th annual Wild Wisconsin Winter Web Conference. I'm Jamie Maciek. I'm with the Wisconsin Valley Library Service in Wausau. I am moderating the well-being track. This is a new track for us this time around, brand new. And assisting me today is Jean Anderson, who's helping moderate. She's from the South Central Library System, and we're so glad to have you here. We have two presenters for this session on why psychological safety matters now more than ever. We have Allison Valancourt and Paula Singer, and they are both with the Siegel Group. Paula is in Baltimore and Allison is in Tucson, Arizona. So Allison and Paula, please begin whenever you're ready.
Thank you.
I just want to say before we get started that I got 2 of my degrees from UW-Madison. So I'm very happy to be with all of the Wisconsin people today.
Great. And Allison and I are delighted to be with you. And please feel free to put any questions you have in the chat, and we will try to respond to them as they come up, or else we'll wait a little bit.
Yeah.
So we have 3 key questions that we're going to try to address this session. What is psychological safety, and why does it even matter? What forces are currently challenging our psychological safety? And what can you do yourselves in your own organizations to increase psychological safety?
That's fun. I just want to give a quick warning. On slide 10 and 11, we're going to be talking about a few sort of, well, they're issues related to death, basically. And so we just wanted to alert you to that. We won't have any images that will be disturbing at all, but if you want to just turn down your volume during those 2 slides for any reason, we wanted to let you know that that was going to be coming. Okay, so Paula, you feel like you're ready to go?
Yeah, let's do it, Allison.
Okay. So let's begin by just getting clear on what we mean by psychological safety. And we really see it as this ability to be who you are at work or in any setting, actually, and not fear that anything bad will happen to you if you express your true opinions, or if you advance a new idea, or ask a difficult question, that you are safe to do that. Paula, any thoughts to add to that?
No, I think that is so true and so relevant nowadays, especially with the remote environment where people are working on culture. And it's a little harder to figure out, is this okay? Is this not okay? And what we propose is that it is okay. And it's important to reveal yourself and share your opinions without fear of any kind of reputation.
And we know that organizations are just so much more productive when people feel like they can be all in with their whole selves. Okay, so we're curious to know from your perspective, how psychologically safe is your workplace? And so we're going to have a quick poll here, and I'll launch the poll. All right, so the question is, which of these statements is almost always true for your work group? And you've got a few choices here. So the first one is, when someone makes a mistake in this team, it is not held against them. Number 2, in this team is easy to discuss.
Allison, people are saying that they can't see the poll. And Jenny raised her hands.
Okay.
Jenny, what did you want to say?
One person has responded, or are people not being able to see
it?
Oh,
there it is.
Now they're seeing it.
Okay, now they're getting it. Good.
Okay. If others aren't, maybe make a note in the chat that you're not. Okay, we're seeing a few more people. Let's see.
All right, it's coming now.
Okay. All right, we'll just give you a couple minutes to make your responses.
Oh, Linda still doesn't have it.
Why would that be?
I don't know. Jamie, anything you want to can do to help?
Yeah, I'm not sure. All right, do you want to end the poll?
People are still responding.
Yeah, let's
Okay.
give it another moment.
Okay.
There are a few other people who seem to, so we'll just, if you, we'll show on the next slide what the questions are at least.
And for the next one, I can try to,
You want to launch it? Maybe it's the
Okay.
power and you're the major host. Yeah, okay.
okay. I'm
Okay.
gonna end it.
Yeah, I think so. 77 of the 97 people have participated. So we will stop this and share the results. And Paula, I'm going to ask you to analyze. What do
What
see
do
there?
we see here? It's only 23 of the respondents said that it is completely safe to take a risk on this team. And I think that's the kind of thing that what we're talking about today. What are different ways to increase that so that it is safe to take a risk on the team? It's interesting in libraries, I almost always see, Allison and I almost always say that it's easy to ask the members of the team for help.
Right.
Always, right, Allison? Because the collegiality and the social connections among the people. You know, that has been important. And I'm happy to see it's 43, but still is not high enough that the members of the team value and respect each other. We'd be interested in knowing more about what that's about. When somebody makes a mistake, it is not held against them. And so in some places it is still held against them. And that's why and discussing difficult issues. It's not so easy, is it, to discuss difficult issues, you know, and problems within your team. So it's kind of interesting. So one of the things we're going to proceed and talk about is how to increase some of these scores so that it is safe, that you can bring your whole self to the table, and open up dialogue for doing so within your own organizations.
You know, one of the things that I think is interesting about item number 1, when someone makes a mistake and this team is not held against them, is when we see really innovative organizations, people are able to say, I'm not nervous about making a mistake, because it's part of the iterative process, it's part of the creative process. We plan to make mistakes. The question is, do we make them early enough? Do we make them small enough? Do we share them early so that we don't repeat our mistakes? So if you're not breaking things, you're not making enough progress typically. And in the organizations that we work with, where there's a high sensitivity about getting in trouble, you don't tend to see very much new or novel. So just make a note on that.
Yeah, that's really important. If people tell me that nobody fails, I kind of say, then you haven't done anything.
Yeah, right.
In a nicer way, of course.
Yeah. So psychological safety was not in the mainstream lingo or vocabulary, you know, several years ago. It's been like the last 10 years or so that we started really using this word or this phrase. And it got a lot of attention because of some work that Google did. You may be aware of their big project called Project Aristotle. And Project Aristotle was designed to understand what makes teams high performing. And by high performing, Google meant things like coming up with novel ideas, being able to execute on ideas, keeping teams together. And they had some theories, and they thought, well, maybe it's where people went to school, or maybe it's where they, you know, what kind of degree they had, what kind of experience. But they looked at factor after factor after factor. And at the end, they came up with, it has nothing to do with the team members. It has everything to do with the team. And what they discovered was that the way the team members worked together really influenced whether or not they were high performing. And so they ascertained that there are really 5 elements that make a team high performing. psychological safety was the top of all the criteria, but a couple of others. And so basically the team members feel safe being vulnerable in front of each other. But a couple of the others were dependability. So this notion that everybody does what they say they're going to do. There's structure and clarity, so everybody knows what their role is. Meaning, so that the work that the team is doing is personally important to each team member, and that the team members feel like their work is important and has impact. And so what Google found is that when we have these 5 elements, we can expect some pretty remarkable things from our teams. But again, psychological safety is the key item here. So Google gets credit for everything. Would you agree, Paula?
Yes. Between Google and Amazon, it's all covered.
That's right. Everything is done. Everything is done. Google did not invent psychological safety. And psychological safety, it wasn't invented by Amy Edmondson at Harvard either, but she was one of the people who really advanced the work. And so we're going to talk about her today. And she's done, I love Amy Edmondson. She's very smart and she's very nice. And I really admire her so much. But she did her early research on hospitals, healthcare settings. And she had this theory, and the theory was this. The theory was that if you had a psychologically safe nursing team, that you would have better health outcomes. That was her theory, and she went about testing it in several hospitals on the East Coast. So Paula, why do you think she would think that psychological safety would lead to better patient outcomes?
Because if people could share their thoughts and take risks, that the patients would be healthier.
Yes. So that is what she thought. And so how do you analyze health outcomes? That's a pretty lofty thing to get your hands
Very
around,
lofty.
right?
Mm-hmm.
So what Dr. Edmondson did was said, I'm going to look at patient errors, right? So if people are psychologically safe, they're probably going to be watching out for each other, and they're going to make fewer medical mistakes, and that's going to lead to better patient outcomes.
Makes sense, doesn't it?
It makes perfect sense. And what she discovered is that she was absolutely wrong, just absolutely wrong. And I picture Amy Edmondson sort of over her desk doing the analysis and then pushing away and thinking, oh no, now what am I going to do? Because what she discovered was that the teams that she had ascertained to be or determined to be high level, to have high levels of psychological safety, actually had more patient errors than the less psychologically safe teams. And I just picture her thinking, well, how am I going to write this up now?
All those years, all that research, all that data.
That's right. That's right. And when she pushed a little further, what she discovered was that the psychologically safe teams didn't actually make more patient errors. They reported more patient errors.
Wow.
Yes. And they reported them because they felt safe to do so. And they know that patient errors happen. And so they reported them early, before things got out of hand, and they were able to course correct quickly. And so the point is that psychologically safe teams make mistakes just like anyone else, but they recover from them much more quickly, and they're more likely not to repeat, or they're less likely to repeat them because they have learned from them. So that was her early research, and it's something that people cite all the time. She also did research related to the Columbia Space Shuttle disaster that happened in 2003. And if you may remember this, I remember it. But imagine being on the ground at NASA, and you ready for liftoff, everybody's excited, they're in front of their monitors, and then the spacecraft goes up in the air and everybody's looking, and it looks fine to most people, but to a set of engineers, it didn't look fine. And a couple of them started talking to each other and saying, did you see that? That looked, something's off there. And what they decided they saw was a bit of foam breaking off the shuttle, which isn't normal, and it didn't seem good. And so all the engineers who saw it got together and talked about what to do. Now, Paula, I'm not an engineer, you're not an engineer, but if you were there, what would your inclination be at that point?
Go tell my boss.
That's your boss, right? So you would think that's what the normal reaction would be, but that was not their normal reaction. Their reaction was to take a vote to see who had to talk to the boss. Right? So they drew straws, and this poor guy named Rodney Rocha gets a short straw, and he has to go talk to the boss and share this news. And he's really nervous about it. And so he goes, he talks to his supervisor and says, this is what we saw. And the supervisor basically said, you know, you're making things up, you're ignoring things, you're making things bigger than they need to be. And he said, you know, we don't need to continue this conversation. So that would be very demoralizing, I think, if I were an engineer. And so he went back to his team and they said, well, we have to do something. And so they decided, in a very risky move, to jump chain of command and go to their boss's boss. And their boss's boss called them all a bunch of chicken littles. And so there was no interest in their concerns. And what was interesting about this story is that there were several meetings for several days after this initial liftoff, and there could have been more conversations, and there weren't more conversations. The engineering team basically gave up and kept silent. And so, Paula, when you think about that, have you worked with groups that have remained silent after doing their best to report something?
Yes. Yes, unfortunately, too many groups in that situation.
Yeah. So the engineers learned their voices were not valued, and so they just remained silent. And you know the rest of the story if you follow space adventures.
Or the front page of the paper.
The front page of the paper, right? Yeah. So the shuttle was coming back into the Earth's atmosphere, and it exploded, and all of the team members were killed. All the crew members were killed. And after this happened, there was, you know, what you would expect, the debriefing that happens. And the analysis was that the culture of NASA was as responsible for the deaths as was the equipment malfunction. And there was a pretty wide acknowledgement that NASA's culture did not tolerate mistakes, did not tolerate reporting mistakes. And so terrible things happened. And so now NASA is considered just a remarkable place to work, and they put in, you know, anonymous reporting hotlines and all sorts of team training. And now it's considered a very psychologically safe place to be, but only after this terrible, terrible tragedy.
Yeah.
So a few months before the Columbia situation, I was at the University of Arizona, and I was the chief HR officer at that time. And I was in my office, and I was having a conversation with a colleague. It was early morning, and my phone rang, and I didn't answer my phone because I was in a meeting. And then my phone rang again, and I remember sort of being annoyed, like, why doesn't this person just leave me a message? I'll talk to them later. So I remember just sort of being frustrated, and I answered my phone. Yeah, it's Allison Valancourt. And it was a faculty member from our Health Sciences Center. And he was sort of gasping for breath. And he was crying. And he said, there's a guy in our building with a gun. He's going to kill us all. You have to do something. And I just remember thinking, well, this is not what I expected when I answered my phone this morning.
No.
And right. And the person on the phone was actually my husband, who's a faculty member at Health Sciences. And so there's this, you know, you worry about your husband, you worry about your community. You know, what am I supposed to do with a guy who has a gun at a campus a mile away from where I'm sitting? And so I said, where are you? And he said, I'm under my desk. You have to do something. You have to do something. And so I said, I'm hanging up now. I'm going to call the police. I love you. I'll call you later. Right. And it was just so, I remember it was so hard, just like leaving that conversation. And so I called our chief of police, and I said, I just got the weirdest call from Richard. And he's like, Allison, I can't talk. Something's blowing up. And it hangs up. So what happened that day was a non-traditional nursing student who's about 40 years old. He was an Iraqi war veteran who had, we learned later, you know, scars of war, I suppose, was not doing well. He was failing his nursing classes. And so what he decided to do was to pay back the nursing faculty members that he felt responsible for his academic failure. And so he walked into the building, he found one faculty member in her office and he shot her there. And then he proceeded to go to the classroom where a nursing exam was taking place. And there were two other faculty members proctoring the exam, and he shot them both in front of all the students in the class. And then he disappeared. And so for several hours, no one knew where he was. And so everyone was in lockdown, and there was searches going on, and it was just sort of chaos for a long time. And then eventually it was determined that he had killed himself. And the reason that we know his motivation was because prior to entering the building, he took a manifesto that he had written that explained all of his anger and outrage and his motivations, and he dropped it in the mail and sent it to our local newspaper. So we're all dealing with multiple deaths, contacting families, right? Trying to take care of the people in the community who've been traumatized by this. And then a day and a half, like 2 days later, on the front page, we get to read this guy's manifesto. So it was a very traumatic experience for the University of Arizona community. And again, like the Nassau case, there was debriefing. Well, how did this happen? Why didn't we know? And we discovered some really tragic, but also interesting things. One, a lot of people had concerns about this student, but nobody did anything officially. Each of the faculty members who was killed talked to their friends and their family and even some of their coworkers about this student, but again, didn't make a formal complaint. And that is not to blame them at all, of course not. But I think their motivation was, this poor guy, right? He served in Iraq, he's trying to get his life together. I don't want to get him in trouble. And so there was no official report. And after we sort of put things together, we found out that people throughout the university community had concerns about this guy. They did not talk to each other about them, so the dots were not connected. So that was the first thing that happened really after that, was a lot of new systems were put into place so that when you saw something that caused you concern, you were able to report it and not, cause a ruckus, right? It's sort of on the record and we can start looking to it sort of softly. But the other thing that we learned was that the college culture at this time was a very, we take care of each other, we don't need other people, we can handle things on our own. And so they did not reach out to resources within the university community to ask for help. In addition, we learned that this college was, I wouldn't say isolated, but maybe sort of self-contained. They didn't do a lot of collaboration with people outside of their college. So they weren't getting the perspectives of other colleagues around the university community. And so they sort of just kept their problem to themselves. And then I think we also learned that maybe the leadership that was in place at that time really didn't like complaining. And so all those elements went into just making a bad situation like just critically dire, right? Mm-hmm. And so we learned from that leaders have to be open to people's expressions of concerns. We need a community response to people who are in trouble, and that we can't be afraid to surface our concerns. So we're going to move to poll question number 2. And Jamie, do you want to tackle this one, see what happens here? Okay.
Yep, I just launched it.
Okay, I hope everybody can see. We'll find out if they can. So curious to know what makes you hesitant to speak up, like the nursing faculty members were hesitant to speak up and the Nassau people were hesitant to speak up.
I also put the poll in the chat if people aren't seeing the actual poll. So feel free to respond in the chat if you aren't able to do it.
Thank you. We're about halfway through with responses. Let's keep going. 64 of 101. What about Paula? Paula, what makes you hesitant to speak up?
I you know, I usually try to say that, oh, very little makes me hesitant to speak up.
Paul is pretty brave.
I'm pretty brave, but I've been around for a while. But I guess, you know, and I see a lot of respondents saying this as well about previous bad encounters when speaking up, because if you've been slapped down once, then slapped down twice, it's not likely you're going to bring something up if you're afraid you're going to get slapped down, you know, especially when it's, you know, in a public arena. And I'm seeing a lot more again, like almost split with the staying in your own
Well, everybody
lane.
can't see the poll results yet, so hold off.
Oh, I'm sorry.
It's okay. We're about 83. So I think we can close now. I think most people have had the opportunity to respond. So Jamie, you
Yeah,
want to show the
83.
results? There you go. Perfect. Okay.
Yeah, so the whole expecting to stay in your own lane, I've seen that a lot in libraries, and I've seen a lot of it changing in libraries as well, where even on leadership teams, I've seen like the marketing person afraid to speak up if they're talking about program in a community, but yet that marketing person could know a lot and have input to that discussion. So I'm seeing that change in a lot of places. Yeah, I think the power differentials are usually big, but always prior experience will definitely rule.
Right.
And we see that in this poll result.
Yeah. So, you know, I think that there are so many things that make us hesitant to speak up. And so just for ourselves, understanding that what our personal inhibitions are, and also thinking about what our team members might be, what might be holding them back. And so power differentials is a very common thing to be worried about. You know, when we do a lot of work, we'll often say we want to separate groups at different levels, because we find out that in interviews or focus groups, people will not talk when someone in a higher role is at the table with them. So that's something that happens. None of us likes to feel stupid, right? So sometimes we won't ask the question that needs to be asked, because we don't want other people to think that we don't know enough. And often when we are brave enough to ask that, everybody says, "Oh, thank you," because I was wondering as well. Fewer of you said you're worried about getting punished, but in some organizations, people do feel like they get punished when they speak up. Previous bad encounters. So Rodney Roach at NASA, he had a bad encounter. He got called a chicken little. He learned his lesson. Do not raise concerns, right? And then the whole, who am I to engage in this thoughts, which is sort of like being in your lane, right? So I was a human resources leader for many years, but I knew more than human resources. I knew organizational strategy. And there were times when I would pipe up about something, and nobody would ever say it, but they would sort of give me the look like, you know, just be HR, don't talk about this.
Roll your eyes. They're rolling their eyes.
Right, yeah. Right. And I know that I would talk to our legal team a lot, and they felt this way all the time, because people would say, this is not a legal matter. I'm like, well, I know more than the law. I have opinions about other matters. But people are reluctant to speak up when it's sort of outside their wheelhouse. And so when we think about psychological safety, it's also important to think about psychological standing. And that's this notion of it sort of says, does a person feel like they have a legitimate right to speak up on a concern? Okay. So this is a picture of men holding a sign that says, men of quality respect women's equality. And there was a time when men who were involved in feminist movements were like, what are you doing? You're a man, you don't really belong in this cause. And then we learned over time that actually we needed men as allies to advance, you know, women's rights causes. And there are so many examples of this. But right now we're seeing this play out, I think, in terms of conversations about race and ethnicity. That white people, for example, like, well, that's not really my issue, or no, I really shouldn't have an opinion about that. And so it makes people reluctant to have conversations. So we know that when members of our teams feel safe, they're more likely to do a number of really good things. They're willing to surface potential dangers. They ask the questions that we really need to wrestle with. They're more likely to introduce new ideas that can move us forward. We learn from mistakes, and so that we don't repeat them. When we feel safe, we're also much more likely to consider diverse perspectives because we don't feel defensive, right? We're not afraid. We're not having someone challenge our opinions doesn't make us feel as uncomfortable. We're just more curious. So we share ideas for improvement, and most importantly, we feel included. And we know that when we feel included at work, we're able to just focus on our work and not have as much anxiety, and so we typically produce better results. So the question is, why does psychological safety matter now more than ever? So that's our question. And we think there are two reasons. One is that we've got new challenges that don't have obvious solutions, so we're figuring it all out. Pandemics will certainly be a big example of that. And then old problems that require new thinking. And so systemic racism certainly would be one of those examples. We're also just living in this environment that's it's hard, right? You may have heard the phrase VUCA world. So it stands for volatility, it stands for uncertainty, complexity, ambiguity. And so, I don't know that the world was ever a very predictable place, but right now there's so much more unpredictability and uncertainty. Paula, thoughts on this?
Yeah, I'm just, I just I forget about it. It's almost like I'm living in it, that this is the air I breathe, and the uncertainty. I'm speaking at the Public Library Association conference, but I don't know if I want to fly to Oregon. It's so complex, so ambiguous, and we are all learning new skill sets in order to be able to deal with the VUCA environment.
And I think what makes it hard, right? I don't know about you, but I'm a list maker, so I'd make my to-do list, at the end of the day, be ready for the next day, and I go when I start ticking through my work, right? And now, as I've talked to colleagues, they say, I don't even know what to do. What should be on my list? I don't know how to do it because everything is changing so fast, and it's just a lot of mental energy, and it's hard. It's really hard. And then when we think about, what are these hard problems? There's no obvious answers. Just the most recent ones, right? Health fears. We want to hit that too hard because everybody knows political polarization, racial injustice, economic uncertainty. So when we're dealing with all of that, just swirling in our heads, and then we come to a workplace that feels uncertain or unsafe, it's just really, really hard to focus. So we don't need to talk about these elements too much, but I'll just tick through it just really quickly. And just to think about, how are we all dealing with health fears? And when the pandemic first started, this is a New York Times article from 2020, early 2020, they thought maybe 240,000 people might die. Now we're over 850,000 in this country. We're not just dealing with the virus, we're dealing with mask or no mask, or vax or no vax, and that's a whole tension. And do you talk to people about it? George Floyd is such a symbol for all the progress that we have not yet made in this country and things that we have to do. And what's been interesting, I think, about the country sort of reawakening to the need to address systemic racism is that people are nervous about having the conversations. So right after the George Floyd incident happened, all sorts of organizations started reaching out. We need a DEI consultant. We need training. We need awareness. We need policies. You heard this, Paula, right?
Yeah, oh yeah.
Yeah. And so there's a lot of reactionary kind of stuff happening. But then one of the things that we learned was that people were really nervous to have the conversations. And some people were vulnerable enough to tell us why. And what they said was, I don't know the words. I'm afraid I'm going to say the wrong thing. And there's this whole vocabulary associated with DI that I don't know what these words mean, and I don't want to feel stupid. And so one of the things that we've done with a number of the organizations we work with is actually have like vocabulary lessons, so that we can just say, these are some words you might encounter, and this is what they mean. And it just makes it easier to move forward.
By the way, we've had that in our own organization, to learn some of these new words and new ways of thinking about them.
Yes, we did.
Yeah.
So curious to know how conversations about racism have affected psychological safety in your workplace. And so if you have a minute and you want to share some thoughts, you can just put that in the chat. It'd be interesting to hear what you have to say.
Yeah, please do.
Yep. Okay. So political divisiveness, we thought the election was over, but it's not really over. It keeps going on. And then lots of economic and labor uncertainty. Certainly, we're seeing organizations shorten their hours right now because so many people are out with COVID. People don't want to come back to frontline roles because they're afraid. And then we've just lost a lot of people in the workforce who are never going to be coming back. So we're going to move to poll question number 3. And Jen, could you launch the poll for us? Thank you. So we're curious about how events that have occurred since March of 2020, when the pandemic really started, how it's affected your level of psychological safety. Lots of responses. How about you, Paula? How has it affected your level of psychological safety?
I've tried hard not to feel pressure to carry out decisions that make me uneasy, but of course I have had to. I've made many decisions without adequate information. Like I always knew that you never have all the information you need to make a decision, but I've never seen it anything like this. I don't know. High levels of uncertainty make it challenging to be, but not only to focus at work, to focus anywhere. And so it has affected me. Yeah. How about you, Allison?
Well, I think that when I think about what's happened since 2020, I think that not having the information I need has also been an issue. But also I joined Siegel 3 weeks before the pandemic started.
That's right. Yeah.
Right. And so like I didn't know anybody, and everybody's in a panic, and I don't know if I can ask questions or not ask questions. And so it was a hard time to start, I think. And I think we've heard from a lot of organizations that starting people during this time has been really difficult. Let's end the poll and share the results, Jamie. Thank you. All right, so high levels of uncertainty have made it challenging to focus at work. Yeah, I think when we have anxiety, it's very hard to focus. Wouldn't you agree, Paula?
Yes, I agree. I'm not seeing the poll results though. Are you seeing it? I'm
seeing them. So I'm not sure why you're not seeing them, but so I have felt pressure to carry out decisions that made me uneasy. That was 45%. Let me go in order. So top one was high levels of uncertainty have made it challenging to focus at work, 74%.
I have it.
Next one is I've had to make decisions without adequate information. That's 52%. Followed by I've sensed that my values and my colleagues' values lack alignment. Followed by I have felt pressure to carry out decisions that made me uneasy. And the last one is that worrying about my personal security is maybe less likely to rock the boat at work. So yeah, so we can stop sharing that. Okay. So
Great.
Yeah. So actually on item number 2, I had to make decisions about adequate information. I'm just going to share a story. So I worked for a university president who was really tough. She was hard to work for. And she was known as a person who didn't solicit much input before she made decisions, which sort of goes against shared governance principles that we often see in libraries or in organizations. And she was asked about it, and she said, gathering input is important, but it's not important forever. There comes a time when we have to make a decision. And if we determine that we have made the wrong decision, then we will make a different decision. And this was I didn't really agree with her on the input because I think input is important, but what was profound to me was this idea that I could make a wrong decision and then go back and just make a different decision rather than being paralyzed and trying to be perfect. So I just always appreciated that. And we're never going to have everything we need to make perfect decisions.
That's a great learning.
Yeah. So I want to talk about ways of thinking about how we feel in times of uncertainty. So Paula, do you want to talk about David Rock's graph model here?
Sure. SCARF, of course, stands for status, certainty, autonomy, relatedness, and fairness. And it's a way of looking at what people need. And there's a little assessment that you can take on this. Just Google David Rock SCARF model or just SCARF model, and you'll find a little easy free one. And people are concerned about these different aspects, and that's what brings them toward feeling comfortable or else toward feeling that they're threatened. So status would be, who am I as compared to? And I see a lot of anxiety around that in libraries where people feel that favoritism is in existence and they couldn't get promoted if they wanted to. And that puts them in a position of threat. Certainty is a big one that everybody's facing now, which threatens psychological safety, threatens comfort and ability in doing work and focusing. Autonomy comes up a lot in terms of what people need. How much control do they have? I've seen systems where, as an example, collection development becomes centralized and autonomy is taken away from branch personnel and managers because they do not get to pick, the books that they want necessarily. And relatedness, people have a lot around inclusion. Do I fit in here? Am I valued? And if people don't feel, it puts them in a state of threat. Fairness is about, will decisions be made in an unbiased way, and how will that impact me if it isn't? So understanding what people's needs are, as colleagues and as managers, we can work toward creating more certainty, providing more autonomy, not having favoritism, not creating an environment where people are committed, definitely building a culture of inclusion, and making decisions that are fair and unbiased.
Yeah. So let's launch the next poll, Jamie, if you would, please. So we're curious to know which element of the SCARF model is most important to you. And this says multiple choice, which is probably an error on my part. So just choose the top, just choose one, please. What's interesting about this is that we all have our own answers, and we're going to find out what your key answers are here. But especially if we work with others, or certainly if we manage others, having them go through this assessment that Paula mentioned is really valuable, because it helps us give them what they need to feel supported as we're going through change. So certainty is not a big need of mine. I mean, I like it, but it's not critical. Yeah. Autonomy matters most to me. I think to you, Paula, right? As well.
Yeah, me as well.
But when I'm working with people where that certainty really matters, I know I need to provide as much information as I can. I need to provide timelines. I need to offer reassurance. I need to say, talk to me anytime you need to, so I can answer your questions, because that's what will be important to them. Okay, Jamie, let's end the poll and share results, please. Okay. So how interesting that only 4%, can you see the poll results?
Yeah, yes, yeah, only 4%. 3 people where status was an issue. That's good, that's good. And fairness is really, really important to this group. Yeah. And that's understandable. I'm surprised relatedness is as low as it is, not that that's low, because big social component of working in libraries.
But I think it's, I mean, regardless of what, there's no right or wrong answer.
Oh, no. They're all what's important to you to feel safe.
Yeah, it's important that you understand.
To Allison's point, think back at COVID. I'm sure many of your library directors were constantly doing meetings for the whole organization on Teams or Zoom and providing as much information as possible all the time. That's really critical.
Yeah. So when we need creative problem solving, which is what we need right now, safety matters more than ever. Psychological safety matters more than ever. So we're going to just, in the remaining time we have with you, talk about a few strategies you can use. And we're going to talk about systems and structures, connections, and learning orientation. So we'll start with systems and structures. We talked about, this is a poster from NASA, but we talked about the importance of having ways to report concerns. And so you want to give people multiple options. Sometimes they can just have an open door policy, they report to you. Maybe it's an anonymous hotline or a tip line or something like that. Maybe there are offices that hear complaints, maybe it's an ombuds office, but giving people multiple options for reporting their concerns is really important. Also having things like checklists and rubrics. And I'm a big checklist and rubrics fan because it just reduces the amount of thinking I have to do. But it creates a lot of psychological safety for folks because they know what the guardrails are. They know this is how I do my work. They don't have to think and wonder if they're doing things right. So the more we can create some systems for people, the more safe they will be. Do you want to talk about why it's important? Explain the why of decisions, Paula?
Oh, no matter what the decision is, employees and managers and directors alike are more likely to follow it. And if they understand it. And I've had so many directors say, I just don't have time, or it doesn't matter. But people really calm down, feel more secure, feel more safe if they understand why that particular decision is being made.
So,
Just a simple explanation is all it takes and very little time.
another way to increase psychological safety that we recommend is to build group agreements, or maybe call them operating principles. Some people call them ground rules. We don't like the word ground rules. It sounds kind of, it's not as sophisticated perhaps as operating principles, but taking people through a process where you say to each other, what do we want to be true of our group? How do we want to work together? And it doesn't take that much time to do it, and it's a good experience. And whenever you're putting together a new project team, it's a really important time to do that. Or if you've just joined the new organization, that can be valuable. But what if you worked for people for 7 years? Would it feel awkward? And I think what Paul and I say is, you can go back and say, I've learned something that I'd like to try here. It's been recommended that we might benefit from going through this process. Would you all be up for doing this? And most people are like, yeah, I'd be fine to do this. And what's nice to have not ground rules, operating principles, is that it gives you something to point to. So when someone, constantly interrupts people, you can just point to the list. Like, this is item number 4 on our operating principles. It takes away a little bit of the pressure to course correct. So curious to know, perhaps you've got a group that's established operating principles, and one of them is respecting each other. And you're in a situation here, and Camilla made a suggestion in your meeting. Anthony replied, can we all agree that from here forward, we will propose only intelligent ideas? And you're a colleague of both of them. How might you respond? So curious to know what you
Put
would
it in the
say.
chat box.
Yeah, well, much. So Paula, you and I have talked about this scenario in the past. And I'm curious to know how your thinking has evolved about this. What would you do?
I would say, Anthony, and you got to do this in a way that doesn't totally embarrass Anthony. But Anthony, all ideas are equal here. We're just brainstorming ideas. You want everybody to be able to bring what they pops in their mind, even if it's not the perfect idea. But here we're brainstorming ideas and they're all intelligent.
So I love the responses that are coming in through the chat, which is, it sounds like most people would say something in the moment.
Yeah.
But not everybody feels comfortable saying something in the moment.
Most people don't.
Yeah, and what happens to Camilla when you don't say anything in the moment?
What happens to, she's dejected.
Right.
She's plus embarrassed, mortified.
Yeah. I don't feel supported by this. Is this acceptable behavior? Right. So one of the things that we suggest to increase psychological safety, another system and structure, is to create options for intervention. And so to help people learn about upstander, the upstander process. So upstander used to be called bystander. I think upstander is the new lingo now. But the idea that you have to do something. And we're not always comfortable being direct, but we have to do something. So in the situation, the direct response would be to take action. So as many of you have said, all ideas are important. Camilla, please go on, right? Another option is to distract. So you create a diversion. So you like spill your coffee or you drop a book or something, and then it sort of disrupts what's happening in the moment. And sometimes you can, change the conversation. You can enlist help. And so maybe you go to someone else and say, I'm really concerned about Anthony. His behavior in our meetings is really shutting people down. So maybe they would ask that there be intervention there. Document using notes, on this date, this thing happened. Think about George Floyd, right? There was a lot of documentation happening around George Floyd. Nobody went to try to break up the fight with the police, but they got their cameras out and they documented it. And because they did, the results, it was very clear that there was no ambiguity about what happened that day. And then delay is checking in later. And so you go to Camilla later to say, I'm so sorry that happened. Are you okay? Now, this is not a big deal. This intervention strategy is often used to interrupt sexual assault. And so that's where it really came from, but it can be used in all sorts of meeting situations as well. But the point is you need to do something. And we want to teach people what their options are.
What Allison is saying is so important, that you need to do something. How many times have we sat in a meeting where somebody says something inappropriate and there's dead silence and you can cut that tension with a knife?
Yeah, for sure. All right, so let's move on to our second bucket of tools, and that is helping people form connections, because we know that when people have a lot of relationships inside their organizations, they feel safer. And that's because they get access to more information. They've got sort of a support system. There's lots of good reasons for that. So one of the ways you can do that is to mix up your project teams. So often on project teams, it's always the usual suspects who get involved, but mixing it up so you bring together people who don't know each other. And there's good creative friction that happens when people don't know each other and they have to sort of create some bonds together in order to get the work done. If you have the resources to create employee resource groups, that can be useful as well. So that could be like, I'm a caregiver group, or I'm a hiking group, or Asian Pacific Islander group, whatever it is that brings people together with some common interests and concerns. That can be a way to build relationships. Communities of practice. So you're bringing people together who do similar types of work, and they get to share resources and education. Paula, you always have good thoughts about this one.
And different kinds of communities of practice. Yeah, it's really important. Sometimes, we talk about the importance of heterogeneous groups, but sometimes people from a personal standpoint want to be together and talk about how they see the world. Groups of BIPOC employees, gender difference, LGBTQ difference, as well as the same way you have children's, youth librarians all getting together, sharing what they know and coming at it from different perspectives is really important.
So the employee resource groups might be, we might bring LGBT members together, or people who have common interests, as Paul just said. And communities of practice is really about your professional responsibilities, right? So
yeah, like the children's library.
The children's library, you bring your IT people together, you bring your HR people together, right? So that people get to know each other and learn from each other. All right, being really careful when you're doing onboarding to make sure that you're building in meeting time is also critical as well. And then we're going to just wrap up today with the third strategy, which is having a learning orientation.
Yeah. So
I was listening to NPR recently, and a 10-year-old grand chess master, this little boy, was being interviewed, and he's so sweet. And the reporter asked him, well, there's times when you lose. How does that feel? And he's like, I am never losing. I am only learning. And I thought, what a great lesson from a 10-year-old little boy. That is how we should always be thinking. And so when we think about think about being wrong from a scientific perspective, right? You don't just stop and pout. You say, oh, that's more evidence. I will use it to learn more the next time. And so being comfortable with being wrong as a strategy for just learning what we should do next, I think is smart. I'm gonna move here. So one thing we recommend is having after action reviews after a big project. We ask what was supposed to happen, what actually happened, why was there a difference, and what can we learn? And do this not when there's a problem, but do it all the time, because that is how you learn the lessons and improve for the future.
And don't wait till the end.
Right.
Do it
Yeah,
midstream as well.
Mhm. So we
Alex,
talked about asking questions that others might have. You can model that so other people get comfortable. Talk about what you're reading, talk about what's really challenged your thinking and what you're wrestling with. We love Think Again by Adam Grant because it's a book about thinking you know something and finding out that you actually don't know it, and some of the joy in that. And the one fun tool you can use in your own teams is to talk about song lyrics that you thought were right, but were actually wrong. And so one of mine was, there used to be a song called Low Rider, and it was like low rider drives a little slower. But what I heard was no dry blood, drive a little slower. I thought it was a public safety message, but there's all sorts of song lyrics that we think we know that we think we know the answers to, but they're wrong. So in the chat here, maybe you know this song, we built this city on. What do you think the next line is? So in the chat, put it in there for us real quick. Let's see what we come up with.
Rock and roll.
Rocky Road.
Rocky Road. I love that.
So my favorite incorrect one is we built this city on sausage rolls. Yeah, so there's, and you may know, I can see clearly now the rain is gone, that people say is Lorraine is gone. So, but this is a fun way of saying we all get things wrong, and that's okay. Asking for help. Jamie, you say something?
yeah, we have about 5 minutes left, just letting
Yeah,
you know.
okay, we're wrapping up.
Thank you.
Asking for help is important. Using pilot projects and trials so that it's not permanent, it's just a test. That can be really useful as well, and it gives people some comfort that things might not be locked in forever. And then just again, to go back to the SCARF model, just here are a few strategies that you can use to help people feel safe as we're moving forward. So that is it for us today. Happy to think about what some of your next steps are, and if you have any quick questions in the chat, we'd be happy to take them. So thank you, Jamie.
So if you do have a question or comment for Allison or Paula, we do have a few minutes where we can take those. A lot of interesting things that were being said in the chat area, and I know you were watching those, Allison and Paula, especially
Yes.
we're talking about, there was a comment that came in that I always tell new people I train that we're not surgeons. If you make a mistake, no one is going to die. It's okay.
Right. That's very good addition, Jamie. Thank you.
I used to work for a university president who had been a cardiac surgeon, and he said, the bleeding always stops eventually. Now, sometimes the patient is dead, but
Would you mind putting on your next slide? I think you've had your contact information.
Oh, of
Yes.
course.
I want to make sure that it's shown.
yeah, thank you, Jamie. So this is, you can find us. We do a lot of work in libraries, and it was just a pleasure to be with all of you today. And thanks for your great comments in the chat.
Yes. And I do want to mention the, yes, the slides and recording will be on the conference website. When you go to the conference website, you'll say post-conference resources. They should be up by Monday, next Monday. So make sure you look for those. So thank you again, Paula and Allison. This was a fantastic session. You gave us a lot to think about. It was a great way to kick off the well-being track. So our next session in this track is at 1 o'clock, and that will be with Amy Franco. If you haven't registered for that, you still can. We also have our stretch break coming up at noon in just 30 minutes. All you need is yourself and a chair, just a half hour of gentle office stretches. We'll also do some meditation. Otherwise, some of you might just want to take a longer lunch break, and that is fine. So hopefully we will see you back at 1 o'clock or maybe in another session. If not, that is okay. Thank you again for joining and for your participation, and have a great rest of your day. So long.